My name is Kaci Peterson. I'm 30 years old, based in Alpharetta, Georgia. Let's talk liposuction. I had the pleasure of getting liposuction on my chin and my arms with Dr. Zubowicz of Zubowicz Aesthetics and Thrive Medical Spa located in Milton, and it was a 10 out of 10 experience. I am on the cusp of my 3-week post-op mark window, and I'll make it a little easier and paste in progress update photos here for you versus just stripping down and showing you on camera. But honestly, already so shook by my results, and the experience I had was, like I said, a 10 out of 10. Absolutely cannot attest enough. If you have been on the fence about getting a procedure like this done and where to get it done, think no further. This is the place, this is the procedure. I had the liposuction done right in their surgical suite in Milton, Georgia, so it was right down the road. And what I liked about it versus a traditional OR environment is it just felt more homey and cozy, and it wasn't intimidating. The bedside manner of both the doctor as well as the nursing staff was superb. And you are technically awake for the liposuction, which I think scared me more than anything. And people that hear me talk about my experience are like, wait, you were awake? But if you go through and see my behind the scenes on my Instagram, you can see me with the little tiny mic broadcasting pretty much throughout my procedure, because that's how good the meds are. Okay, so it's like a local anesthetic. You're not under an anesthesia, you're not asleep. You're awake, like I said, but you're on some happy concoction. They also have happy gas if you want to opt into it. I personally felt like I didn't even need it because the experience was so seamless and I was having fun. That was my quote to literally everyone in the room, as well as my caretaker who was driving me home from the procedure. I just that was just so much fun. I had a great time, because honestly, in the world of aesthetics, and even if you're not in this world, a lot of it can be an intimidating, scary thing. But like I said, the bedside manner, 10 out of 10. The space itself was amazing. I just felt at ease. The happy meds truly do make you happy. And the procedure itself, I had the chin and arms done, was in and out within 2.5 hours, which is pretty awesome. My biggest thing with something like this and any type of self-care or like self-treatment, whether it's your injectables or an augmentation of any sort or liposuction, they're trigger words. They can be scary, it can be intimidating, what you see on the internet and other people's experiences. It's all about who you're going to see and where you're going and their reputation. And Dr. Zubowicz is a double board certified plastic surgeon. He's been practicing over 20 years. Zubowicz Aesthetics has his reputation of itself. Thrive Medical Spa also has a reputation of themselves of 5 stars, okay? And the 5 stars don't only speak for themselves. I am a true patient across the board, and my testimony is just do it. What are you waiting for? If you're waiting for a certain time of year, why? There's minimal downtime. You can be back in the water and back in submerging within 7 to 10 days after your procedure. As far as like getting back to everyday life, honestly, I was like back in my groove of things within 48 hours, but keep in mind you will have your compression garments on. So that'd be my only disclaimer, is I had it done in the thick of summer, the middle of June, July. So it's a little bit toasty with wearing the garments on my arms, but worth it, because by the time I took my cruise, which I just got off of this past week, I didn't have any more bat wings. This shirt's kind of hard to tell because it's looser, but I will post in before and afters just to give you an idea. And again, I am not fully done with my results. I am just in the midway point at the 3-week mark. You technically aren't done swelling and seeing like more of your results until the 6-week window, which is the kind of the beauty of liposuction. It just keeps getting better and better. And something I will say that I love about Dr. Zubowicz specifically is the bedside manner and the fact that he does not beat around the bush, okay? He is straight to the point. He's gonna keep it real with you. Consultation process to me was pretty seamless in that regard, as far as just like asking those blunt, transparent questions, and like there's no dumb question, especially if you're talking about a procedure, okay? So the environment there between him and the nursing staff was incredible. I feel like all my questions were answered. I definitely felt like I had my hand held in the moments that I felt were a little scary. But overall, I would say, outside of it just being a 10 out of 10 service, the actual procedure itself and being awake during it, as intimidating as that may seem, wasn't bad. I mean, honestly, you're on such a happy little concoction, the happy medicine local anesthetic situation, that by the time you get back in the operating area, I was just so chill. I could have opted in for happy gas. At that point, I felt like I didn't even need it. I felt like I was having a good time. They inject you with a numbing fluid. I think it's called a tumescent fluid. I might be saying that wrong. I probably am. But that fluid numbs your treatment area. So during this treatment, you're not actually feeling what's being done. If anything, I felt like a vibrational, like like a little shake, like kind of something like shaking on the areas that were being treated, but nothing painful, no poking, no prodding, nothing crazy. What's funny is watching the procedure back, I like could not believe what it looked like, because I was like, wow, that was happening. I had no idea. As far as the fat removal, some people were like, Kaci, you don't even have fat on your chin, you don't even have fat on your arms. I know what you're talking about. Listen, everyone has fat. Okay, that's not being mean, that's not to trigger anyone. And as much as you could say it was all in my head, I had over 450 cc's of fat removed from me. Okay, just in those 3 treatment areas, chin and both arms. And that to me, just seeing that in the jar after my procedure was enough to tell me, like, I'm so glad I did this. Not only that, I'm an active person. I am in Pilates, I'm in boxing, I work out on a regular basis. There's so many things I've worked out naturally, and then there's certain things that just weren't going anywhere. So especially with the arms and certain movements in Pilates and the bat wing or the bingo arm or whatever you call it, that already has subsided and I'm not even fully in my full results mode. So that speaks for itself. Chin, I'm still technically swollen. I still have like a little bit of like here, but it's going. We're smoothing, we're contouring. Already though, you can see this definition. I did not have this before, and he treated both chin and neck. So just even this contour here, where you can see the shadows and see this collar, my neck used to literally come out further. I will, again, pictures for reference. And also, again, note, I'm not even full results yet, but I just had to get out here and share this testimony. If you're waiting, stop waiting. Prioritize yourself. At least get in there and ask the questions and see if it's the right fit for you, and talk to Dr. Zubowicz and his team. Consultations are complimentary. They also offer financing, and for me, out of all the places I priced out, they were the most affordable option, but the most like reputable option. This is a double board certified plastic surgeon performing this procedure. It was local to me, but even if it's not local, it's worth the trip to have that 5-star experience. I've also heard horror stories about liposuction not having results, or I didn't even see like what was done, or I can't see a difference. My results speak for themselves, and they speak on a daily basis, okay? So I will continue to update and share these testimonies along the way, but I just had to come out here and plug this little nugget of just do it. Treat yourself and you won't regret it. So just some quick hits from a non-medical professional, just the patient point of view of questions that I've gotten were first price. So for pricing, it does kind of range, I think, depending on the treatment area, amount of areas you're doing at one time. But I think it averages between $2,000 and $2,500 per area. So in total with mine and a combination discount of getting multiple treatment areas done at once, saved me a little bit. It was around $4,500, but again, that can vary based on what you're having done. I have a friend who's actually getting the 360 lipo done on her abdomen as well as her inner thighs, and I believe her quote was closer to the $6,000 to $8,000 range, but that's just because you have multiple areas when you are considering 360 lipo. So everyone's a little bit different, and again, consultations are complimentary, and you're gonna start there anyway, so you might as well do a consultation while you can. And do a consultation ahead of time and get an idea of pricing. And they also offer payment plans, which is very nice. And you doing it there locally and not going under an anesthetic saves you a ton, okay? All right, now as far as downtime, this is like a minimal, no downtime procedure. You are technically leaking the numbing solution fluid situation for the first 48 hours. I know that sounds scary and like what the actual heck. It's not that bad, I promise you. Nothing. Your incisions are like these micro incision points, and there's only technically like one per treatment area, I believe. You can actually kind of still see just that one little marking is what I have on my chin, and then I have one here and here for both of my arms. That's what's leaking, so it's nothing crazy like pouring out of you, so don't let that scare you or deter you, and that's only happening within the first 48 hours. You are free to go back in and swim, pools, showers, full tub, all of that after that 7 to 10 day marking. So minimal, and you can tend to like go back to work and do your thing, I would say within 72 hours, like without question. You just have to keep in mind you will be wanting to wear your compression garments on your treatment areas for a maximum amount of time. So I'd say that that's the only downtime to consider, but you're not down, if that makes sense. Let's walk through results. So keep in mind, I'm still not on the full after side. This is still a progress update. And your true like afters, or like when you're healed, is typically closer to that 6 to 8 week mark, and I'm between the 3 to 4 week mark. But I'll give you like a kind of a step-by-step of everything I've tracked thus far. So within the first 48 hours of my procedure, this is what I was working with already with my chin. yeah, that's even swollen. Keep that in mind. I'm swollen. I'm in recovery mode. I'm technically like supposed to be like even bigger. Then I went in there and no, I was already snatched. We were already snatching. We love to see it. Same thing with the arms. When I came out of the compression, or I came out of the wrappings and had to put my compression garment on, I was looking at the compression garment, like there's no way my arm is gonna fit in there considering my normal arm size. With this is like something I've been insecure about. I'm telling you like my whole life. It doesn't matter how skinny I've been or in shape that I've been. This underarm, bat wing, flab, bingo arm, whatever you wanna call it, is something I've always been insecure about for myself. Now, that's not me bullying myself. It's just something that I haven't been able to get under wraps. No matter how hard I work out or work on those areas, diet, whatever, this area wasn't going anywhere. Now, within the first like 48 to 72 hours after the procedure and going out of the surgical wrappings into putting on the compression garment, number one, I looked at the compression garment like there's no way I'm gonna fit into that. Look how small that garment is. The fact that I was able to put my arm in it already told me everything I needed to know. Like I am already on the other side of this huge insecurity that I've had for 15 plus years. And I mean, honestly, I almost cried. Not even gonna lie, I almost cried. The results again speak for themselves. This is within that 48 hour, 72 hour mark. And then within that first 2 weeks, this was me at my 2 week check-in. Wow. Results speak for themselves. I also do Pilates and boxing, and when I see myself in the mirror doing certain movements and hitting certain power moves and jabs, I would always see that flap. So even since post-op and getting back into my workout routine and watching certain movements, I'm like, holy moly, it's not flapping anymore. Okay, and I'm still technically, like I said, in that recovery, swollen process. So the fact that we're already looking like this is everything you need to know, okay? Being the thick of summer when I got this done, I'm so glad I did it in summer because my arms and my chin were both snatched before going on a cruise I just went on last week, and that was within 3 weeks of my procedure. So that says it in itself. If you're waiting to push the button or like wait till you have downtime for something like this, you don't technically need it, so don't wait. As far as a compression garment though, just be mindful of like when you're gonna be wearing your garment and having that on. The chin one is like a full head wrap thing, so you don't have to wear it out to work or anything like that, so you can just go about your day. And as far as the incision is so tiny. The best comparison I could give you is like the tip of this pen or pencil, one per the treatment area. So I have like one little incision marking underneath my chin and then one at the base here for both of my arms. And already you can see it here, and you can still see where I'm swollen. This is gonna go away and it's gonna snatch itself right up where you're still in the recovery process. But that just shows you what incision. Okay, and this is just 3 weeks out. I would say in the first like 72 hours, then that first week mark, it was obviously like a darker reddish color and it's fading already. Same with my arm. Sometimes I can't even find the one on my arm. I have to kind of like get in the mirror and look for it when I'm trying to like show someone where I had it done. So if you're worried about looking like banged up or like you got work done, you don't. So that already in itself tells you, why are you waiting? It doesn't need to be something you wait to do. Also be mindful of liposuction can be such a trigger word and trigger procedure for people because they've seen miscellaneous stories and results and different brands online. It's all about where you're going and who you know. Take it from me, I'm who you know, okay? I 10 out of 10 recommend Dr. Zubowicz, Zubowicz Aesthetics and Thrive Medical Spa in Milton, Georgia. This is not a sign off for you to get lipo anywhere in the world with anyone in the world, and that is all going to be the same. It is literally where you are going. He is a double board certified plastic surgeon with over 20 plus years in the industry. He has performed all kinds of different aesthetic procedures and liposuctions. He knows his stuff, and he's not going to beat around the bush with you in your consultation of what he thinks you're a candidate for, which is what I truly appreciate about him. But he's also charismatic and has that fun bedside manner with the nurses to where it's not this big, intimidating surgical scene. It really does feel like you have a little bit of that medical spa perspective meeting the plastics side of things, and you feel like more at ease in that environment, or at least I did. Again, like I said before, 10 out of 10 experience, and I cannot recommend enough Dr. Zubowicz and his team of Zubowicz Aesthetics and Thrive Medical Spa in Milton, Georgia. And I'm gonna be back. I'm already like, what? Okay, whatever else I've been on the fence about or debating, I need to talk to you, Dr. Z. We need to we need to go back in the drawing board on some other areas that I want to get treated, because it's such a big, scary thing we do to ourselves in our mind when we go down the rabbit hole of woulda, coulda, shoulda, woulda, whatever, or I'm the worst at procrastinating self-care efforts. Don't. Okay, we have to fill our cup so our cup can runneth over with others. And that's with anything, whether that's taking care of yourself and going to the gym, speaking a new language, getting a new job opportunity, getting a cosmetic procedure done, whatever it may be. Stop waiting and prioritize yourself. It's my only advice that I could say. And if this video can encourage you at least just to set up a consultation and get the conversation started for yourself, then that's a win is a win. Okay? So again, my name is Kaci Peterson. I'm 30 years old and highly, 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 highly recommend Dr. Zubowicz and his team for liposuction in Milton, Georgia.